Hello, friends, and welcome to episode 1271 of the Juicebox Podcast. Welcome back, everybody. Today, Jenny Smith and I are adding to the Bold Beginnings series with this episode about using CGMs. Please don't forget that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. If you or a loved one was just diagnosed with type 1 diabetes and you're looking for some fresh perspective, the Bold Beginnings series from the Juicebox Podcast is a terrific place to start. That series is with myself and Jenny Smith. Jenny is a CDCES, a registered dietitian, and a type 1 for over 35 years. And in the Bold Beginnings series, Jenny and I are going to answer the questions that most people have after a type 1 diabetes diagnosis. The series begins at episode 698 in your podcast player, or you can go to juiceboxpodcast.com and click on Bold Beginnings in the menu. If you'd like to help with type 1 diabetes research right from your own home, and you're a U.S. resident who either has type 1 or is the caregiver of someone with type 1, go to t1dexchange.org/juicebox and complete the survey. It's that simple to help. Type 1 diabetes can happen at any age. Are you at risk? Screen it like you mean it. Because if just one person in your family has type 1, you're up to 15 times more likely to get it too. So screen it like you mean it. One blood test can help you spot it early. And the more you know, the more you can do. So don't wait. Talk to your doctor about screening. Tap now or visit screenfortype1.com to get more info. And screen it like you mean it. This episode of the Juicebox Podcast is sponsored by the Omnipod 5. Learn more and get started today at omnipod.com/juicebox. Check it out. The episode you're about to listen to was sponsored today by AG1. You can drink AG1 just like I do by going to drinkag1.com/juicebox. Check it out. Jenny, good morning. How are you?
I'm well. How are you?
Good, thank you. I'm excited to add to the Bold Beginnings series.
Yay.
I think that it is maybe the most popular series, certainly among newly diagnosed people, but in general, people seem to really like it. It made me think a little bit, by the way, this is a little tease, about a way to kind of refresh the Pro Tip series, which, when we're done here, I'll actually run my idea. Let me make a note here to myself to tell you what I was thinking.
We talked about this a while ago, just because of all of the new technology and the algorithms that have really shown up compared to when we did majority of that.
Even though it was only a handful of years ago. Yeah, I think there's a nice way to refresh it. But the Bold Beginning series, we're just going to add to today. I'd like to talk about basically wearing CGMs, the accuracy, best practices, that kind of stuff for people, because I think you get diagnosed or you have a child who's diagnosed and all of a sudden you're wearing a device. This is obviously very new and different for somebody.
Right.
And then there's some quirks about wearing technology that aren't obvious, you know what I mean? And
yes.
Ways to manage. That's a good way to say it, right?
Yes, they are kind of, I guess quirks is a good, yeah.
So, I think no matter what you're talking about here, Libre, Eversense, Dexcom, CGMs, right? They're going to tell you, look, put them on, and it's going to tell you what your blood sugar is. And it will. And they're great. They're absolutely fantastic. But you might then take your meter out, check your blood sugar, and say, oh, my meter says I'm 96 and my CGM says I'm 115. Which is it? So let's talk a little bit about how CGMs work first versus how about how BGMs work. And then we'll lay it out for people so they understand, give them some tips and tricks to get through and set up some expectations for them. Does that make good sense?
Sure.
Okay. So I'm going to start by asking you some technical stuff that I don't understand as well as you do for certain.
Okay.
I use my blood sugar meter and I check a drop of blood from my finger and it says I'm 96. Why is it possible that my CGM doesn't read the same?
It's possible because your blood glucose meter is reading the glucose in your blood. which is technically the more accurate. It is the more real time right now. So your glucose then kind of shifts out, moves through our interstitial fluid that surrounds the tissues and the cells and everything in our body in order for the glucose to kind of move into cells. That's a very simplified explanation, right? But sensors, CGMs, do not measure blood glucose. They measure the glucose that is in that interstitial fluid. And that's the reason that you can see a difference between a blood glucose and a CGM value, because they are not reading glucose in the same fluid in the body.
Okay.
And that glucose, again, from the blood has to kind of move out, transport through the interstitial fluid. And so many people know the term or the thought of lag in CGM data. A lot of people talk about that. And that data can lag then. Finger stick is here. CGM is higher than this or lower than this. The reason is because there's a lag in that glucose sort of transport, if you will, into the interstitial fluid. And as we'll probably talk, it's another reason that hydration,
very important,
really, really important. So
very high level, not technically. Someone one day said, hey, there's glucose in your interstitial fluid. We could measure that and help people with diabetes using insulin. I'm going to read this. Interstitial fluid is the fluid that surrounds the cells in your tissues. It plays a crucial role in transporting nutrients and waste products between blood and cells.
Yes.
When you're using a continuous glucose monitor, it is important to understand how the interstitial fluid relates to blood glucose monitoring. And Jenny's already brought up, there's a lag, right? And this lag could be 5 to 15 minutes from a finger stick.
Correct.
Okay.
Correct.
So somebody figured out, probably not that hard to figure out if you're like, a scientist or you went to college or something, that there's glucose in there. We can measure it and we can help people not have to poke their fingers all the time and still get close enough to what's happening that it's really valuable for them. Okay, so interstitial fluid, similar to blood plasma, it says, but without the high concentrations of proteins found in plasma. It contains water, electrolytes, glucose, and other small molecules.
Correct.
So then if you're dehydrated, then that fluid is not where it needs to be volume-wise, I imagine. So why does that mess with the reading? I partnered with AG1 because I needed a daily foundational nutritional supplement that supported my whole body health. I continue to drink AG1 every day because it works for me. AG1 is my foundational nutritional supplement. It gives me comprehensive nutrition and it supports my whole body health. Drink ag1.com/juicebox. When you use my link to place your first order, here's what you're going to get. A free welcome kit that includes a shaker, scoop, and canister. 5 free travel packs. A free year supply of vitamin D. And, of course, your AG1. So if you want to take ownership of your health, it starts with AG1. Try AG1 and get a free 1-year supply of vitamin D and 5 free AG1 travel packs with your first purchase. Go to drinkag1.com/juicebox. That's drinkag1.com/juicebox. Check it out. My daughter is 20 years old. I can't even believe it. She was diagnosed with type 1 diabetes when she was 2, and she put her first insulin pump on when she was 4. That insulin pump was an Omnipod, and it's been an Omnipod every day since then. That's 16 straight years of wearing Omnipod. It's been a friend to us, and I believe it could be a friend to you. Omnipod.com/juicebox. Whether you get the Omnipod DASH or the automation that's available with the Omnipod 5, you are going to enjoy tubeless insulin pumping. You're going to be able to jump into a shower or a pool or a bathtub without taking off your pump. That's right, you will not have to disconnect to bathe with an Omnipod. You also won't have to disconnect to play a sport or to do anything where a regular tube pump has to come off. Arden has been wearing an Omnipod for 16 years. She knows other people that wear different pumps, and she has never once asked the question, should I be trying a different pump? Never once. Omnipod.com/juicebox. Get a pump that you'll be happy with forever.
Well, tell me what happens when you have a really teeny tiny amount of water that you try to put a whole bunch of sugar in. Does it stay fluid or what happens?
Oh, it gets more viscous.
It gets concentrated,
Yeah.
right?
Okay.
It gets kind of sticky. So not only are you impacting everything else that needs to be transported in your body in the right way, which, I mean, that's a whole just physiology discussion, but honestly, electrolytes play a big role in transport of even glucose and other sort of nutrients in the body. So when we're dehydrated, that concentration of all of these can kind of get slow in movement, as well as more concentrated, right? And so that can shift glucose readings. It's also the reason on the opposite where people, again, know this term, it's like a compression low, right? Yeah. Where you're laying on your sensor, what you're doing is compressing that sensor so much that not all, but a good majority of that interstitial fluid gets shifted away from the sensor. And so what ends up happening is glucose levels drop. And not until you roll the child or the person over, they get up and kind of things get moving again, fluid comes back to normal, levels that it should be at, then that glucose number jumps up, right, and is actually where it should be. So as you can see, hydration and proper hydration in the whole body can make a really big difference in.
So like a compression low, as an example, almost like putting your foot in a puddle and you displace the water. So if you press hard on the sensor, you're displacing the interstitial fluid, which contains glucose. You're pushing that away from the sensor. And then that's why all of a sudden you look low out of nowhere, because you technically pushed the glucose away from the sensor. And now suddenly there's less there than actually exists in the body.
Right.
Interesting. Hey, here's a little side note that you'll probably completely agree with. Only about 30 to 40% of adults meet the daily recommendation for water intake. And the remaining 60 to 70% may not be adequately hydrated, with varying degrees of mild to moderate dehydration. So my point in bringing that up is I think most people hear that and think, I'm not dehydrated, but you very likely could be, especially kids too, who,
Correct. And honestly, having worked with a good percentage of athletes in the past very heavily, our biggest recommendation for hydration is that when your body finally gives you the signal that you're thirsty, you are definitely dehydrated.
Okay.
You should not have thirst, so to speak. That's like, oh my gosh, I have to get a glass of water right now. You are not hydrated well. Like you're underhydrated at the point that your body is giving you signals.
Right. I'm just going to say here, your urine should be what?
Oh, yes.
How do we measure our hydration? By the color of our urine.
Your urine should be like very light, pale lemonade.
Makes me want to sing Lemonade. That cool, refreshing drink. Clear or light yellow typically indicates good hydration. Pale yellow, also a sign of good hydration, suggests that you're well hydrated, but not overly so. Bright yellow can indicate mild dehydration or the presence of excess vitamins. Oh, yeah, that's true, too. If you take a multivitamin, your pee could get bright, right?
And especially B vitamins. So I always recommend, if you know that you're really doing a good job of hydration and you've just taken like your multivitamin or a B complex or something like that, and your pee is like this golden color, don't worry about that.
Dark yellow often indicates dehydration and that your body is currently conserving water. It's interesting. An amber or honey-colored, stronger sign of dehydration, important to drink more water. Orange, wait a minute. Orange can be the sign of severe dehydration. Brown could indicate severe dehydration or the presence of certain medical conditions such as liver disease. Pink or red is blood in the urine. Wait a minute. Jenny, this has nothing to do with what we're talking about, but blue or green, unusual colors can result from certain medications or food dyes. Rare genetic conditions, bacterial and then cloudy or murky could indicate a urinary tract infection or a kidney stone. Okay.
Well, and from the color that pink, it may not definitely be blood. If you have had a fair intake of beets recently.
Beets or berries.
Beets or berries, an intake of those can definitely discolor the urine. Beets can also really discolor sort of poop. So just as an FYI.
Wait, what color does beets make my poop?
Kind of like, it's almost like a reddish color.
No kidding. All right.
Yeah. So there you go.
Sorry. We go over it like this because being hydrated is super important for your CGM working, but it's also very important for your insulin working as well.
Correct.
So we might as well talk about it here because you're getting a double benefit. If you're wearing a CGM, you're going to get more accurate readings. And if you're using insulin, which if you're listening to this, you very likely are, your insulin is going to work better. So can we take 2 seconds on that? Tell people why a well-hydrated body uses insulin more effectively?
Absolutely. Again, it's a transport component, right? We're injecting or infusing insulin into what we call the sub-Q tissue. So the layer that sits like right underneath the skin, which is why your little cannulas or even the insulin needles on your pens or your syringes, they don't really go in very far. They're not terribly long. The idea is that with proper hydration and fluid movement in the body, that insulin, along with the chemicals that help it to get used in an appropriate timeline, it works along with the hydration of the body. And again, if you're underhydrated, things are not going to be moving as easily. I consider dehydration, especially like in circulation, it's kind of almost like molasses in winter, right?
Yeah.
Things move really slow. Once you get hydrated, things move and flow the appropriate way. Your insulin, all of the nutrients, all of those things, they get moved to the right places in the body in the time frame that the body is meant to do it.
I was going to mention that extreme temperatures can affect the rate in which glucose diffuses into your interstitial fluid. So that is a potential impact for your CGM readings. Yes. Also different like blood flow. So like sedentary versus exercise, again, increases the rate. So some best practices, first of all, be aware of lag time, right? And that's an interesting one because here's a real world example. Arden's blood sugar will, dip down to 63. And I'll send her a text and I'll say, hey, did you do something about this? And she'll say, yeah, I'm good. I did, I drank this or I ate this or whatever. And then 5 minutes later, the CGM will still say 63 or it'll go down again. And then I get the tap, tap, tap. It's my wife. She's low. And I'm like, no, I know, but she's already had something. Well, this thing's still beeping at me.
Right.
And I'm like, yeah, I know, but I think we did enough. I think we did enough. It's going to come back. You got to wait. I find sometimes you need to wait 10 minutes.
At least.
Yeah, to see.
Yeah.
And if you go ahead.
Oh, I was going to say, and it could also be longer depending on what you've used to treat that with, right? Thus, the reason that we really recommend dextrose or really simple sugar, something that's going to get moving fairly quickly. Because if you don't, then not only is the CGM potentially lagging, but it might be also even behind further because of what you ate, not being fast enough to reliably start bringing that blood sugar up.
Right. But in a case when you have done that, when you've taken in that simple sugar and it's bounced, like say you're 63 and CGM says 63. You wait a couple of minutes after you drink a juice and you test and you get a 75 test. And you think, okay, this hit, it's coming, right? The CGM's not suddenly going to say 75. As a matter of fact, the next time it reads, you could end up being 15, 20 points higher than the last time.
Right.
And so I just want to say here, you really still need a really accurate blood glucose meter and you should use it. I know. And listen, Dexcom is a sponsor. Eversense is a sponsor. I think CGMs are fantastic. I don't know what I would do without them. You still need a really good meter and you should test your blood sugar. That's all.
100%.
Yeah.
I 100% disagree. And
Jenny, you just said I 100% disagree.
Oh, I 100% agree. I 100% agree.
Yeah.
What I was going to say in terms of, disagreement is I disagree with the fact that people are really heavily relying on only their CGM and that they're really only waiting to do a finger stick when their own body symptoms are telling them something that seems off compared to the CGM value.
Right.
I mean, I think if I were the one setting up any of the sensor systems, my recommendation doesn't get into calibration because there's a whole strategy with calibration and that kind of stuff as well if it's needed. But my best practice is doing a finger stick when I get up in the morning.
Yeah, just to see.
Because it gives me a visual of the CGM has been here all night. I have no food in my system. I have no excess of insulin from boluses or anything that could really be impacting right now. I do a finger stick before I get out of bed, so I don't have that quick shift in blood sugar that could happen for many people, right? That foot on the floor. And I compare. And if it's off, within this set comparison, I may calibrate. But 99% of my mornings, I'm not calibrating.
Yeah.
I'm just comparing and saying, yep, it looks great. Fabulous.
Close enough even. Like,
Yeah.
But what you don't want is to get out of bed with a blood sugar of 140 and your CGM's like, oh, you're 95. And then,
Correct.
Then the whole day just, you're 45 points off. Everything that you do, the first bolus you make, it leads to probably a rise, because you didn't have enough insulin. And this doesn't stop. And even if the CGM comes back in line eventually, great. But it just throws you. I'm just a big fan of testing once a day at the very least.
Agreed.
Yeah.
Yes.
Getting older means a world of change, but some things still stay the same, like being at risk for type 1 diabetes. Because type 1 can happen at any age. So screen it like you mean it. If just one person in your family has type 1, you're up to 15 times more likely to get it too. And 50% of type 1 diagnoses happen after the age of 18. So screen it like you mean it. Type 1 diabetes starts long before you need insulin, and one blood test could help you spot it early and lower the risk of serious complications like diabetic ketoacidosis, known as DKA. So don't get caught by surprise. Screen it like you mean it, because getting answers now can help you get prepared. The more you know, the more you can do. So don't wait. Talk to a doctor about how to get screened. Tap now or visit screenfortype1.com to learn more. Again, that's screenfortype1.com and screen it like you mean it.
We have Dexcom alone. I know the other systems have something else, but Dexcom has clarity reports, right? And so clarity reports will give you an estimated, it's not an A1C, but an estimated average, right? They call it a GMI, a glucose management indicator. And that gives you a value close to what A1C would represent from an actual blood draw. And in comparison, some people get really frustrated. Well, my A1C came back at this, but my GMI, according to Clarity, was telling me that I should be here or here. And it's frustrating. My first recommendation question is, are you doing finger sticks?
Right.
If you're not doing finger sticks, let's start doing several finger sticks a day. Because I would almost say that in the majority of those cases, the CGM is what's off. The CGM is not on with the finger stick enough. And so your GMI is then reporting an average that's not actually what's really represented in your blood, right? So I think there, in the case of things being really different, it's just a good strategy to do even more than one test a day for, even if it's just a week.
If I'm listening to this and I'm more newly diagnosed, what I would want you to take away from this is maybe some of the best technology that's ever existed for people with diabetes.
Agreed.
That and algorithm pumps are going to change people's lives with type 1. And you should not walk around bemoaning, oh my gosh, I'm 95 and it says I'm 110. That's astounding. Be very happy. Okay.
Right.
But the next thing they're going to think is, well, if I'm really 95 and it says I'm 110 and I'm on an automated system, is it not going to give me insulin based on 110? And, should I be fearful of that? I've never come up with a better answer other than to say that my daughter has been on different algorithms for a long time. This has never been an issue. And I know that is not a comforting statement.
Right.
To me, it's the same question. It's the same answer as back in the day when somebody would have, 4 different meters and they would take pictures. They'd test their blood sugar with one meter, then with the next one, then with the next, with the next one. They get 4 wildly different numbers. And they'd say, great, now which one of these should I use?
Right.
I'd pick the most accurate one. Go look online, see which one of them they have is most accurate and go with that. But at some point, you don't remember that moment probably because you were a kid when you were diagnosed. But I remember the moment of swallowing hard and going, this is the meter. I don't know if it's right or not, but I got to go with it because I got to go with something. Like, I'm not in the hospital. She doesn't have, we're not using a $10,000 blood glucose meter. Like, you know what I mean? Like, this is the one I have. And do you know what I'm saying? Like, it's a real big leap to make.
It is. And unless you really know, as you already said, you can look up accuracy online, right? There are charts. I mean, Diabetes Daily, there are a whole bunch of different places that have accuracy chart by different brand. They even have the off brands, right? That are on there for an evaluation. I always say choose the one that is not only on your insurance plan coverage wise, but also choose the one that's on that list that is the highest accuracy according to these charts.
Yeah, there's like 3 meters at the top of the chart. Listen, Contour NextGen is a longtime sponsor of the podcast, and it's the one we use. It's a very well-ranked and rated meter. And
they've rated top of the charts for years.
Long time.
That particular meter. I kind of right up there with it is, I wish I could use that one. My insurance doesn't cover that one. It prefers AccuCheck brand. So I use the Guide or the Guide Me. That one has very similar to the Contour accuracy readings.
Yeah.
So again, look, because that also translates into, if you're going to be calibrating, as you brought up, I check on this meter and then I check on this meter and I check on this meter, and I have 3 varying results. And this day you're using this particular brand, and this day you're using this particular brand at work to calibrate your CGM. Don't do that. Pick a meter.
Pick one.
Pick a meter and use that one to always calibrate.
It just freaks you out in the beginning. Like, it does.
It does.
Like, you know, you're fairly newly diagnosed. You're like, well, this meter says my blood sugar is one thing. The CGM says another thing. Then you start going, well, which is it? And I always tell people, I'm like, I don't know. Is it a $4 meter? And a Dexcom, I'd probably trust the Dexcom more. But like, I don't think it's a more or less. It's an understanding of, once you have as accurate as you can blood glucose meter CGM, then understand the lag time. Really seriously look at your hydration. You know, are you in an extreme temperature situation? I'm wearing a CGM today. I got in the shower and my blood sugar went up 45 points. I have a working pancreas. Do you really think my blood sugar went up 45 points? Right. So there's that stuff to remember. It also, when you put it on, is really important. So going back to CGMs, and Jenny and I talked about this before we started. Again, I want to say again, I don't want to scare anyone away. Definitely get a CGM, okay? But the first day ain't as good as the second day. Ain't as good as the third day. And then all of a sudden, when you get to the end of the sensor, it could trail away again. Some people have great luck. Some people's physiology works great with them. And
the whole time.
Oh my God. Just boom, all good. I saw Arden had a G7 go bad in the last 3 hours last week. And other than that, I've seen they go right. She wears them right out to the end every time. And the longer she's wearing them, the better they look for her, like accuracy wise. So, but keep that in mind too. If you're in a 10-day window or a 14-day window, it's boring, but there's that little sensor is under your skin and it's in there, and it takes a little time to, what's the word people use? Marinate. Sink in. Yes. Right. Like, get set. Who cares what's actually technically happening? Dexcom added what to the G7? It's a grace period.
There is. So after the 10 days, you have a 12-hour grace period that the sensor will continue to work before it's fully expired. And in that grace period, it will continue giving alerts and alarms and all of the regular stuff. They've just given, a period of, sometimes life is what it is, and you planned to be home at 2 p.m. to change it, and your train got stuck, or you're stuck in traffic, or you had to go pick up your dog, or whatever happened. And now you're either without a sensor because it has fully expired, or now with G7, you've got 12 hours beyond that 2 p.m. that it's still going to help you until you can really get home. And so which is nice.
I'll tell you what I try to get Arden to do, and she fights me all the time about it. But, I'm always like, look, put a new one on now while the old one's still working. And just let that thing sit in there for a while and get accustomed to its surroundings. And, because if it doesn't work as well in the first couple of hours or the first day for some people, then let's try to buy some more time there. And then we'll swap it back on the end by taking the free 12 hours on the backside if we can.
Right.
That makes sense to me. So the people call that like marinating a new sensor, right? You just, all you do is you open up the G7, pop it on, and then you don't do anything else.
You don't start it up. Yep.
Nothing. Hold on to the box, hold on to the sensor, and then when it's time to switch, you scan that one and jump to the other one. And you might very well see better numbers coming back from it the longer it's been in. We try to do it for a couple of hours at least, but she's just, she's tough. She's young. You know what I mean? And I'm like, it doesn't
She's
matter.
doing a million other things.
Yeah. It's hard for her to get, but it's a great tip. Is that something you can do with Libre? Do you know?
Oh, that's a really good question.
I don't know if you can.
I don't
think so.
I don't know.
Okay.
I would honestly, because Libre is similar in that the device also is like G7, that it just pops on. There's no additional transmitter to pop in, or it's like a one and done kind of pop it on. I think it could be possible because you still have to enable that CGM to get started with the app. So I would expect, but I don't know for sure. Honestly, the majority of people that I get the opportunity to work with are either Dexcom or, the small number who get really good accuracy with Medtronic's Guardian system, which is nice.
How do you find the predictive alerts work for CGM? Like the ones who tell you you're going to be low in a while, do you notice that they are helpful?
I think that they can be helpful. What I've seen the best, though, and it goes back to hydration. It really? It goes back to the reliability of your fluids moving the way that they're supposed to through the body, and that data that then gets transmitted from blood into the interstitial fluid, it's going to register a shift. That's going to trigger however you've had that predictive alarm set. Either you have it set really conservative or really aggressive to alert you sooner or later to that drop happening that could predispose you to the low.
Where are you at on calibration? Do you calibrate?
I calibrate if necessary. Yeah. Yes. The majority of my sensors, I've had really, really good luck, if you will, with my Dexcom for a long time.
I'll have Arden calibrate once in a while. It doesn't come up that often. I think you really have to pick through what works best for you. Like some people will say, look, I put that thing on and 6 hours into it, it says I'm 65 and I'm 90 and I calibrate. And some people will tell you like, don't calibrate on the first day. And, in Dexcom, all the CGM companies, they don't really talk about how to best do that. So I would say this.
They do tell you that you can calibrate. And most of them, if you read the fine print in their owner's manual, there is a defined strategy to what they recommend for calibration. And how far outside of that could actually create sort of a setup for where the sensor is just going to fail itself because you have overgiven it information, and the algorithm that's changing that sensed glucose to a number to tell you what it is, it gets all messed up.
You could just confuse it.
You could confuse it.
Do you find sensor placement? Because, there's the places where they've tested the sensors so they can say you can wear it here, but people move them all over the place. Do you find that you have better sites, some than others, for accuracy?
I do. Again, leg sight isn't technically approved. I don't wear it. I also don't wear my pumps on my thighs either. Neither of them work ever for me. But people find special places that do definitely work. Many times they're the approved sites, and the majority of the time they are not technically approved sites. My recommendation is test it. This is another opportune time to use your glucose meter to make sure that it is actually really serving you well there. And then if it is, great, keep using it. I mean, we all have limited real estate on our body.
Yeah. I don't know that Arden has ever worn a Dexcom on her arm. A G7. She wears them on her sides of her hips or butt, upper butt kind of thing. Yeah, like there. So let's talk a little bit about the quality of your management is also going to add to the quality of your CGM accuracy. So if your blood sugars are not constantly bouncing up and down or super high or super low, you are going to see, I think, more stable, accurate readings back from a CGM.
Correct.
Yeah?
Yes.
Okay.
Absolutely. And with the difference between those coming, again, speaking Dexcom specifically, those coming from G6 to G7, where there is no longer smoothing of the data, right? That bounce could get worse visibly in the data points with somebody who has a lot more rise fall happening, looking a lot more like a roller coaster, those numbers, again, data points on the CGM graph, they could look a lot more jagged and up and down, even as the glucose is going up and down, compared to somebody who has a lot smoother transition from data point to data point.
Yeah, that. And then my point is that if you do simple things like we talk about in the Diabetes Pro Tip series, like pre-bolus your meals, have your settings closer, you're not going to see as much variability and you're going to see more accuracy out of your CGM as well. Right. Also, do not calibrate while your blood sugar is moving. So
correct.
If you're rising very quickly, falling very quickly, that is not a good time to calibrate.
No.
Does thyroid have impact on CGM accuracy at all? Or do you think it just has impact? Because I looked into it a tiny bit. So you can have an overactive thyroid, right? Which would maybe speed up your metabolism, as an example. Mm-hmm. Would that maybe move glucose through you differently? It's an interesting, I don't know if it's right or not. It just it popped into my head. I'm like, I wonder what medications people are taking that might have an impact on this as well.
Well, I do know, obviously, and most people who are Dexcom users know about acetaminophen. Mm-hmm. And in fact, while they cleared that push to avoid acetaminophen, I think it was once G6 came out, they still will ask you if you are trying to return a failed sensor if you had used acetaminophen. My expectation is that they're looking potentially maybe for a dose that's more likely going to fail a sensor comparative to just using, 500 milligrams of something once a day and you had no effect whatsoever. I know vitamin C is another one. Higher doses of vitamin C can certainly affect the accuracy. I think it's a Freestyle Libre 2 for vitamin C. And, a lot of people might not even realize that they're using a large amount of that. If they're taking some type of a powder that includes a high amount of vitamin C, they're not technically just taking a chewable or a daily vitamin. Uh-huh. They may not think that they're really going to have a problem. They may not realize it's in something else that they're eating.
Yeah. Okay.
But those are the two bigger ones that definitely have impact.
So with overactive, underactive thyroid, I'm just kind of picking through some of the notes I made earlier. It's going to more change like underactive thyroid, slower metabolic rate could delay glucose uptake into cells, which could affect how quickly changes in your blood glucose are affected. All I'm saying is that if you have hyperthyroidism, it's not crazy to think that you might see janky readings from your CGM, or maybe it's a little different for you than it is for other people.
Maybe.
Listen, if I'm wrong, that's fine. You have to imagine there are other things impacting this. It's not as easy as I put the thing on and the thing don't work. You know what I mean? Right. And that's what I think always happens with people is they just kind of don't see the bigger picture. And I understand why, right? Because you don't buy tires and think, oh, they wore out faster, but I drive faster than other people. You just think I bought the tire.
You drive more than other people.
Or the roads are worse or whatever. You just think I bought the thing. They said 30,000 miles, 60, it didn't last. There's reasons why things happen. I don't know what they are sometimes.
Yeah.
You just need to think bigger when you're trying to decide how to make this thing work the best, because this is going to be a very important part of your life with diabetes until they come up with something different. And I don't know if there's something different to come up with. A CGM might be the greatest advancement for people using insulin, in the last 20 years.
Absolutely.
Yeah.
Yeah, absolutely. I mean, in terms of that accuracy too, and calibration and whatnot, there are strategies, like I said, in the fine print of the books if it's this far off, this is when to add a calibration. I know in the realm of people with diabetes, there are so many conversations about when to calibrate, how many calibrations to put in. Should I change the number from this to make it closer to the actual to put into the system so that I don't confuse it? I mean, there's so many different things.
Yep.
My first recommendation is always go by what the system is telling you is allowable for a calibration and try that first, right?
Follow the advice from the company about how to handle it.
Correct. Yeah. Exactly. And then, Bob on the corner who has his own proven strategy, you know what? If you've tried the strategies and they don't seem to be working, maybe try Bob's strategies, but I wouldn't necessarily rely on them
100%
working for you.
Do you have a second to go over adhesive stuff?
Sure.
Okay. So some people are going to have adhesive allergies. And it's not crazy to say that every once in a while, some of you are going to have significant adhesive allergies. But, big surprise, you have autoimmune issues and your body tends to overreact to things. So skin preparation, so it's tough, right? Because they're going to tell you to clean your skin with alcohol.
Yes.
And for some people, maybe a person with very oily skin, that might be really important. But for some people who have more sensitive skin, taking out those oils could lead to, bumpy, dry skin, that kind of stuff. We are more like light soap and water, pat dry people. We don't use alcohol to clean the sites. In that idea somewhere might be something for you. So if you're noticing your skin getting very dry, bumpy, scaly, the first thing I would do is I'd get away from alcohol if you're using it to see what happens. Not a doctor, not advice, etc. and so on. It's what worked well for us. There are skin barriers.
There are.
Skin Tac, Terraderm. What's the other one? IV.
Well, there are a couple that help with stickiness. So if you're having a problem on the end of things not staying stuck, there's some things that are patches for that, or preps, IV prep, all those kinds of things that actually help adhere. But then there are more patches, IV 3000, and those types of barriers that are hypoallergenic. They're typically clear. They come in multiple different sizes. And essentially you would clean your skin with whatever method you're going to do, let it dry, put that on the skin, creating a thin barrier upon which then you're going to apply the sensor, or you're going to pop the sensor on over. So the sensor adhesive is not technically touching your skin.
Right. So you're just trying to create a barrier between you and that adhesive, because some people are never going to be bothered by it. Some people are terrible. They can't wear it. You feel horrible for them. Some people can't get it to stay on. Some people can't get it to come off. And you're gonna hear people online like, well, I don't know why they don't make it more like this, or they're trying to make it down the middle.
Good
so
for
it
everybody.
Helps most people. And you might have to make some adjustments. Hypoallergenic tapes, adhesives are a way to get around sensitive skin. There's these holders, like some 3D printed like holders I've seen people use.
Yep. And that's actually for the people who really can't do an adhesive. So what happens is they'll put a dressing on. The adhesive will essentially not be on their skin. And in order to hold, especially like the pod or in the infusion set, or even the sensor on the skin, that sort of 3D printed is almost like it's like a cage that sits on top.
Yeah.
And then there's a band that goes around to actually hold that in place.
Or you could use different adhesive that doesn't come on your device that maybe you can deal with.
Yep.
Keep moving your sites. If you're having reactions, can be helpful. Hydrocortisone creams, antihistamine, stuff like that. Like if it gets to that point for you, there are ways to manage it. And for those of you who can't, I'd say if you absolutely can't figure it out, like if your skin just doesn't work, then I think you got to look at Eversense for the implantable CGM.
Right. Because
they have their transmitter is on a silicone based, I think I'm saying that right, silicone based adhesive, which I don't think causes much dermatological, is that right? Issues?
If not, you just made up a good word. There you go. I
made up a great word.
Works for me. Yeah. So good.
Okay, so anything we're not talking about here that you can think of? Anything we missed?
The only thing that I would say in the same line of thought that we were just talking about would be really make sure that after you remove any adhesive, whether it's a CGM or a pump site or anything, you really clean that site well. Because I see a lot of times just a basic like clean over it with like an alcohol or something to kind of get the sticky stuff off, but you never really completely getting off all of that residue. There are some really good residue removers. There are even some that are more like essential oil type, more homeopathic that work really well, that are just good for the skin. I also think keeping skin really overall, people with diabetes can tend to have drier skin. And so making sure that you're overall really well moisturized as well. Does that sound weird?
No.
Sorry.
Slather on the cocoa butter or whatever you're using.
Slather it on. Yeah, coconut oil, actually, I mean, it's great for a million wonderful things. And it is, it's a wonderful.
Did you know you can refinish leather products with coconut oil?
I did not know that.
Yeah. I did it with an ottoman once. It worked very well. Treat yourself like an ottoman, Jenny is saying, and moisturize your skin.
And moisturize your skin, and especially those sites that get used and used and used, really make sure that they get nicely cleaned and hydrated.
How about, from your perspective, nutrition or vitamins that would help with that? Anything that pops to mind? That's an outside of the box question, but because I'll point out that hypothyroidism could lead to dry skin as well. So if you're under medicating your thyroid and you're experiencing dry skin, that would not be crazy if your TSH was, if you're one of those people walking around with a 4.5 TSH and your doctor's like, it's fine, which probably isn't. You probably want to push it under 2.1, but like that could be a thing. But I mean, are there, like when people take multivitamins, are there foods that help with skin health, or am I just making that up?
Well, I'm quite sure I'd have to go to my skin health kind of guide, but I mean, there are certainly things that are very good overall, even in terms of aging, which is not what we're really talking about, but it kind of goes right along with keeping your skin healthier, more stretchy, keeping things more elastic rather than getting, paper thin kind of skin. There are definitely nutrients in food. In terms of supplemental, I'm always one to say, try to eat it in food as much as possible rather than peeing out a whole bunch of expensive stuff that you may not actually be in need of.
Well, Jenny, I asked our ChatGPT overlords,
yay.
They said that benefits of vitamin A: produces cell production, helps repair. Vitamin C boosts collagen production.
Yep.
Vitamin E acts as an antioxidant. Omega-3 fatty acids reduces inflammation, keeps skin moisturized, supports skin barriers function. Zinc can add in skin repair and reduction of inflammation. Biotin B7 supports healthy skin by improving the skin's hydration. Collagen, protein essential for repair. Vitamin D plays a role in skin cell growth and repair. So, yeah, I mean, eat well, always a good advice, but, all these things could be valuable for you.
And interesting, a very valuable thing about all the rest of those is that they are highly recommended in people with diabetes anyway.
To begin with, yeah. If you're taking care of yourself, you might be taking care of your skin by mistake already.
Right.
Cool.
Yep.
All right. Well, I want to thank you. I'm going to let you go, but then
thank you.
I'm going to tell everybody to hang on for a second because I'm going to go over some things that I have in my notes that I'm not sure if we hit or not. So
fabulous.
There'll be more right after this.
Yay.
Thank you. All right, guys. Jenny's gone. She had to get going, but I put together so much stuff to talk about in this episode that I just wanted to kind of roll through it very quickly and make sure that it's all highlighted for you. So I'm going to go through very fast. These are things you should be researching maybe on your own. Super simple stuff, right? Sensor insertion, clean the site, use proper placement, rotate your sites. Calibrations, like Jenny said, follow the manufacturer's guidelines for calibrations and try very hard. Only calibrate during stable glucose levels. Do your best to keep the sensor dry. I know you can be in and out of water with them, but the better you keep them, maybe the better the adhesive's going to stay. It won't be moving around. That could end up helping you. Stay on top of when the sensor expires, right? You want to know when it's going to shut off. Are you noticing janky readings and you're more towards the end? Maybe that's why. Take a look at maybe swapping it out a little sooner. If you don't know what's happening, call the company, ask questions, go online, find Facebook groups, go to the Juicebox Podcast Facebook group, ask other people who are users. You might get some great information from them. Skin health, hydration, super duper important. A balanced diet. Now, not just a balanced diet for your skin, but a balanced diet so that your blood sugars aren't bouncing all over the place. You're monitoring your blood sugar with a CGM, which just works better if your blood sugar is not super variable. You're always going to need adequate sleep, keep your stress down, get mental health support, Remember that alcohol consumption moves your blood sugar around. CGM is going to bounce around with it. Now you're a little loaded and the thing's jumping around. Might be harder to pay attention to. I'm not saying that alcohol changes its ability to work. I'm saying alcohol can have impacts on your blood sugar. And now you are trying to decide what you're seeing on your CGM when you're inebriated and it's bouncing around a little more. Scrolling down, super important. I know we went over it, probably felt boring to you, but understanding how interstitial fluid works, what it is, and how the CGM is monitoring it, really important, especially for understanding lag time and that's impact on what your readings might be versus your blood glucose meter. I can't suggest enough a quality blood glucose meter. Contour, next.com/juicebox. Great, accurate meters there. Are other medications impacting your readings? Jenny mentioned acetaminophen. Also, beta blockers could have an impact. Check into that with your doctor or online. So regular monitoring, consistent medication use, regular endocrinology visits. Some other stuff to keep in mind, the Dexcom G7 has a shorter warm-up time of just 30 minutes. You can plan your sensor changes to give yourself some marinating time. Very helpful. Between me and you, I don't care what the company says about never needing a calibration. You need your meter. You should be checking your blood sugar and seeing if there are drastic differences, just so you know, okay? And then you can make a decision about calibrating. But you want to make sure that you understand what's going on. That's Libre 3, Dexcom, all of them. Adhesive, skin prep, barrier methods, hypoallergenic adhesives, rotating your sites, making sure you get all the adhesive off, and managing reactions if you have them. Finding a healthcare provider to help you with this may be necessary if you're having significant allergies to adhesive. You can consult a dermatologist, look for barrier creams, non-adhesive alternatives, medical grade silicone tapes. All these things might be possible. This would be a time to get online, find other people who have this issue, and see what's working for them. That's it. Did you know if just one person in your family has type 1 diabetes, you're up to 15 times more likely to get it too? So screen it like you mean it. One blood test can spot type 1 diabetes early. Tap now, talk to a doctor, or visit screenedfortype1.com for more info. The conversation you just enjoyed was sponsored by Omnipod 5. You want to get an Omnipod 5? You can. You want to make me happy? Do it with my link, omnipod.com/juicebox. I'd like to thank AG1 for sponsoring this episode of the Juicebox Podcast and remind you that with your first order, you're going to get a free welcome kit, 5 free travel packs, and a year's supply of vitamin D. That's at ag1.com/juicebox. Are you starting to see patterns, but you can't quite make sense of them? You're like, oh, if I bolus here, this happens, but I don't know what to do. Should I put in a little less, a little more? If you're starting to have those thoughts, if you're starting to think, this isn't going the way the doctor said it would, I think I see something here, but I can't be sure. Once you're having those thoughts, you're ready for the Diabetes Pro Tip series from the Juicebox Podcast. It begins at episode 1000. You can also find it at juiceboxpodcast.com up in the menu, and you can find a list in the private Facebook group. Just check right under the featured tab at the top. It'll show you lists of a ton of stuff, including the Pro Tip series, which runs from episode 1000 to 1025. If you're not already subscribed or following in your favorite audio app, please take the time now to do that. It really helps the show. And get those automatic downloads set up so you never miss an episode. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. The episode you just heard was professionally edited by Wrong Way Recording. WrongWayRecording.com.